Hi, welcome to class. We're going to talk about the sources of HESCs. What is that? Human embryonic stem cells. That's what we've been talking about. We have a guest here today. Let's see, there is a jackhammer going on in my neighborhood today, of course. But let's see if you guys can welcome our guest.
Hello.
Aw, so nice of Scooby-Doo to join us today. He really wants to learn about human embryonic stem cells, so I said he's totally welcome to join us. What do we know? Most of the sources of the HESCs are spare human embryos. What are spare human embryos? They are leftovers from IVF. So when couples do IVF, there's always, well, okay, not always, almost always, never say always or never, extra embryos. So for every round of IVF, you might get 6, 7, maybe only 3, maybe 1, up to 12 viable embryos. You implant the ones that look the best, are healthiest. 3, no more than 3, right? People should never have more than triplets. Even then, sometimes those split to identical twins, right? People will have, you know, quadruplets. Anyways, not healthy, so they generally don't put more than 3, sometimes only 1 or 2. And so there can be extras. These generally then sit stored in freezers in fertility clinics. The parents have the option to not use their remaining embryos, right? And many times in certain places, they can donate these to other couples, or they can donate them to research, or they go in the trash. So there aren't, at this point, anybody making embryos for embryonic stem cell research, at least not in this country. So sometimes, right, some of the stored from way back when it first started, it's been going on for over 20 years, right? They're stored, we can't find their owners. And legally, you can't then donate them to research. They're somebody's embryos. So they may sit unused. Is that okay? We're good? Yeah? What do you think? Scoob? Okay, good job, buddy. Glad you're with us. All right, so what is IVF? It is in vitro. What does that mean? That means in a petri dish, or like that's, you know, what everybody thinks, petri dish. It's just not in a person. In vivo is in something living, in vitro is not in something living. So this, with embryo transfer, can result in test tube babies, right? IVF, so good pregnancy. Blah, 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 let's look. Oh, sorry, really quick, because this was such an amazing process. It has created so many children for infertile couples that used to have to go without, or their only option was adoption. The Nobel Prize in 2010 for Physiology of Medicine went to Robert Edwards for developing this method. And that's just, you know, such a great method too. Yeah, Scooby thinks so too. The very first baby born from in vitro fertilization. Holy cow. Like this, 1978. Like that's crazy. That's so long ago. I was a kid. You guys were born. Yeah, completely nuts, right? Yeah, Zoinks is right. Okay, so what do? We collect eggs. So that is done laparoscopically, but first you got to get a whole bunch of shots of hormones. It's pretty intense. It's not good, according to friends of mine who have done this. And then we take those eggs into this nutritious broth, add those spermy guys, right? They can fertilize the eggs. We get up to what is normally the number of cells before we go into implantation, right? So they are then pipetted essentially into the uterus, where then they can implant. So we stick them in there right when it would be normal cell number to implant. The female has all the hormones as if you were in that cycle of ovulation, ready for implantation, and then hopefully a normal pregnancy can develop. So here we go. Here's a mature oocyte. It's ready to be fertilized. You can see, maybe, let's zoom in, maybe let's see. Whoa, extreme close up of the sperm all around, trying to get in, making themselves at home. And then 3 days after fertilization, we have the 8-cell stage. Whoops, right there, this guy. And we're almost ready to go right on in. So here we go. IVF to stem cells, what happens, right? If a leftover embryo, so just incidentally, just a fun little fact, freezing embryos before implantation works better than using them fresh, which is crazy. So they all go into liquid nitrogen, and then you take them back out, I don't know, maybe a day later to do the implantation, or however long, right? They have to make sure the woman's hormones are right and she's ready for the implantation. Might not exactly sync up with when IVF was done. So that's how they figured out that it was much better. They had much better success if the embryos were frozen first. Who would know, right? I mean, I really don't know. So, okay, not really that awesome. But so this guy out of the freezer, right? And then the ICM, right, inner cell mass, or depending on if it hasn't gotten to that stage, which generally they don't, any of these cells now are totipotent, right? Remember, what's the difference? Totipotent, pluripotent? Totipotent can become everything. If they haven't yet made the blastula, or the blastocyst, or whatever you want to call it, with those outer trophoblasts and the inner cell mass, then they haven't even differentiated that far, and they can become everything. So they're multipotent, right? And then we let them multiply in sterile environment, and then we see stem cells here. These are the feeder guys. Remember that from that other lecture? And we have stem cells ready to be experimented on. What else? Pre-implantation genetic diagnosis, or PGD, is where you can actually pull a cell from one of those embryos and check its genetics to make sure it has all the right chromosomes, there aren't any abnormalities, there aren't any translocations, there aren't too many chromosomes or too few chromosomes. And so it's a little embryo biopsy. And then that helps determine which ones should be implanted. And so a lot of times, according to, the in vitro doctors, they can tell by visualizing which ones look good and which ones don't, based on how many mitotic rounds they've done in what amount of time, whether they're going to implant and do well or they're not going to do well based on statistics of what they know. But this little biopsy really makes it available to look at those chromosomes without affecting that embryo. You can pull one cell out. Remember, they're all multipotent, and it'll still be fine. So the PGD's been done since 1990. Again, that's still a way long time ago. It doesn't seem that long ago for me, but that's like 30 years. Oh my God. Okay, sorry. That is scary to me. That 1990 was 30 years ago. 31, no, 30. Sorry, I forgot what year it was. Okay. But it's really done a great deal to, not have offspring with these horrible genetic disorders, especially if it runs in your family. Blah, blah, blah. Let's move along. Ethical issues with PGD. Yeah, if you want to know, you'll know. They're implanting 3 girls, a boy and a girl, female, male, how many you want. This other problem of the savior sibling, you have another child in order to HLA match for somebody with a disease. Again, you're gonna love that child, it's your child, and if you're gonna have another child anyways, why not make it one that can save the child you have? But again, that's all your ethical issues. Embryo destruction, lots of these are bad. Lots of embryos are bad. Lots of embryos that we make naturally are bad. They just go away before you even know you're pregnant. And then they worry about custom-made babies, eugenics. Could we look and see what color eyes and hair? Oh, skin, oh, teeth. Save yourself on some braces, people. Check the teeth. I'm kidding, kidding. Everybody, kidding, right? Jokes. It's just exactly. All right, so blah, blah, blah. Okay, so here's our thing, created purely for research. No, we're not doing that. Yes, you can't get funding for that. You can't get anything for that. The cloning, right? Human embryo that contains entire genetic makeup of someone else. Reproductive cloning, right? That's bad. We can make pluripotent stem cell lines this way. That's adult using regular old cells. We're gonna get to those, don't worry. So right now, we're not essentially creating human embryonic stem cells for the lab. We're only using leftovers. What else? Other sources, yay, adult bone marrow, stem cells. We talked about these guys a little bit from adult bone marrow. Normally produce blood and bone marrow cells. Now, right, since we can do iPSCs, we can actually use bone marrow to do that too. And since they're not fully differentiated like a skin cell, it appears to be a little easier to make them go back and then go forward. We'll talk about that as we go. Cord blood, again, umbilical cord blood, usually discarded at birth, can contain some stem cells. They're a minute amount. Remember, we mentioned that a little bit. Sometimes you can donate to a stem cell bank, just like you can donate bone marrow to see if somebody's a match. Sometimes you can't. It just depends on where you do that and what forms you fill out. The blood could be used to help that child if it ever became ill, but you do have to pay to have it stored, and it's not cheap. So I feel like there's a little gouging going on, and they get people hysterical about this could save your baby's life, blah, blah, blah. Yes, but with iPSCs, if you're going to be able to spend all of that money, unless it happens to be a blood disorder, you're going to spend a fortune, which is great, but then you can just use the baby's skin cells. So you don't need to spend a fortune storing cord blood just in case something disastrous happens. Now, if blood issues run in your family, right, hemophilia, any of that kind of stuff, then it's possible that we could use that. But if it's a genetic disorder, then that baby's blood is going to be bad, and so those stem cells are going to be bad, and so then they're going to need somebody else's anyways. I'm not saying don't do it. I'm just saying you need to not freak out and let the companies that are trying to get your money convince you that it's a lifesaver. Do your own research, as we should always do, right? Yeah, I think that's probably true. Yes. Thank you. Aw, Scoob, you're so cute. Okay, so this is a really nice table in case you need to go back whenever we're reading primary research articles or looking at anything to look at the differences and similarities, right? So our attributes, that would be our good stuff, our limitations, that might be the bad stuff, and then our ethical concerns are things we need to think about, and we need to think about for ourselves as well. So in vitro fertilization, right, all the good or bad, we destroy human blastocysts. You have to get what's informed consent, right? The parents have to say it's okay to use them for research. Nuclear transfer, this is the cloning, right? All cell types, right? Stem cells can be matched to the patient. Exactly, you can take their own DNA, right? You still have to destroy that human blastocyst, right? If you're taking DNA, putting it back in, blah, blah, blah. Informed consent to get the eggs to even do that in, right? And then, right, we don't want to do the wrong thing. And then adult tissues, right, matched to patients, they're limited. But as far like for bone marrow, this is what we're talking about, adult mostly. There's no ethical concerns. If you can isolate somebody's adult liver stem cells to help them regenerate a bad liver or replace them after a surgery or cancer or anything else, it's their own cells. It's just money, money, money. No ethics, all money. And then last but not least, just a few places to look. Although it's so easy to Google now, we don't need to worry about these exact places. But if you want to know more, Google's out there. These are some relatively reasonable sites to look at. And yeah, I think that that's pretty much it today. So we're going to have another lecture soon. And we will thank Scooby for joining us. And thank you guys. I will see you next time. Thank you. Uh-oh. Oh, I don't know how to stop the recording. It stopped? No. Can I click that? No. Why can't I? Here we go. It's right here. Okay.